Hi, I'm Dan.
I'm Mike.
I'm Chris, and our team is the High Flyers.
We have an enviable healthcare system in this country, but it is not cheap. We know from the data available that Australians make over 127 million GP appointments every year. The biggest cost of healthcare, however, is drugs. We spend over 10 billion per annum on. Collectively, PBS-listed drugs represent $435 per capita. However, that changes with remoteness, where in the NT this drops below 100. The healthcare outcomes show the difference for those unable to access or obtain treatments. But are all these drugs good for the health of the population and indeed the economy? We analysed the data for our local region and here's what we found. First, we are getting older. Second, it would appear we're making more money. We also indexed the cost of health versus tax credits and found something odd. In the last few years, we went backwards on a revenue versus cost index, green bar. Looking more widely at healthcare costs on a demographic basis, it is evident that the older Australians command a far greater share of Medicare benefits. So regionally it can be expected that with 28% of our population over 60, local healthcare costs would seem higher on a per capita basis when compared with tax receipts. The top 10 pharmaceuticals dispensed to Australians are almost all constant, repeat doses of condition-controlling medications. There are also drugs that are controlled in their release due to the potential for human harm should they be misused. And finally, there are use cases where people reliant on carers or located in rural and regional areas miss out on some of the benefits of our healthcare system simply due to their remoteness or physical isolation from ailment. For these users, getting scripts filled is no simple matter. But it could be. Introducing the Healthcraft.